Hello everybody and welcome to my vlog. This week I'm doing a vlog that I've been inspired to do by a very good friend of mine, Nick Haste, who's part of the amazingly successful Pixie duo, and you can find those on YouTube. And Nick has multiple sclerosis, and she discovered that about 5 years ago, and she's talking very openly about it in one of her own vlogs, and she came on my radio show last week to talk about it, and I'm going to put a link to that in the comments afterwards. So, what is multiple sclerosis? It's where the own body's immune system attacks the protective sheath that covers the nerves. This is called myelin, and it breaks those down in both the nerves of the body and in the brain. And then messages don't carry so well between those nerves, and so eventually things start to not work as well as you wanted them to be. So when you want your arm to move, for example, the messages can't get through, and so that movement becomes more difficult, and so on and so forth. The nerves and the brain actually get scars or plaques in them from these, even if they're getting a little bit better afterwards. And sometimes the actual nerves themselves get damaged, and all of this slowly but progressively distorts the messages. So what are the symptoms of multiple sclerosis? Excuse me from this cough. So it really depends what nerves are affected. So whatever that nerve does as a job, if it's affected by multiple sclerosis, you will have problems doing that thing. So it can be sensation and it can be movement. Multiple sclerosis is different for everybody who's affected, and that's one of the most important messages. But amongst the things that can happen is you can get a loss of balance or dizziness, you can get a tremor, you can get stiffness or spasms in muscles, speech difficulties, memory problems, mental health and emotional difficulties, visual problems, tiredness or fatigue, bowel or bladder dysfunction. So problems going to the toilet, pain, swallowing problems. The list is almost endless because we have nerves governing everything we do all over our body. So what are early symptoms? Well, there's no typical pattern. As I said, multiple sclerosis is unique to everybody who suffers from it. Optic neuritis, which is where you lose the vision in one of your eyes, normally just one, can actually be an early sign of multiple sclerosis, and actually it was the early sign for Nick. She actually had loss of vision in one of her eyes after each child that she gave birth to, and so that happened twice for her, and that can sometimes indicate that multiple sclerosis is underlying the issue. So who gets multiple sclerosis? Well, there are 100,000 people in the UK who are living with it day in, day out. There are 5,000 new diagnoses a year. That's 14 a day. It's a lot. 1 in 600 people have multiple sclerosis, and most new diagnoses come between the ages of 40 and 60, but all ages are affected. Even children get multiple sclerosis. It's more women than men, but depending on what type of multiple sclerosis it is, but overall about 2 to 1. So as I said, it depends what type you have, and there are different types of multiple sclerosis. So there are 3 main types. There is relapsing, where the symptoms from an attack that you had previously reappear. It could be the same or a different body part that's affected. They last for about 4 to 6 weeks, and then those symptoms get better, they resolve. But half of people have lingering problems with each attack that they get. And this is the most common type of multiple sclerosis at first diagnosis. Then there's primary progressive, which means symptoms get worse gradually, but you don't have these gaps in between like you do with relapsing, where things get better or stay stable. 15% of people get this as their first diagnosis. It can appear to stay at the same level for a long period of time. And again, it's commonly diagnosed in people between 40 and 60. And in this particular type of multiple sclerosis, men are affected in the same numbers as women. Then there's secondary progressive. This comes after relapse in multiple sclerosis. So somebody who has a relapse in diagnosis can eventually evolve into secondary progressive. So instead of relapsing, getting a bit better and then relapsing again, the symptoms become continuous, as in primary progressive. It used to take 20 years for that transformation from your first diagnosis of relapsing to move into secondary progressive. But now with the medications that we've got, that seems to be much longer. So that's good news at least. So how do we diagnose multiple sclerosis? Well, it's difficult is the answer, and it often takes time, often takes months. So if you suspect that you have any problem which might be indicative of it, you see your GP. And if they are unsure, or even if they suspect, they will refer you to a neurologist, because it's a neurologist that will handle your care. They will do a neurological exam, they'll do an MRI scan to look for these plaques or scars on the nerves or in the brain. They will do evoked potential, so they will look at your nerves and do special tests to see what's going on with individual nerves. They may do a lumbar puncture where they take some fluid from your spine to look at special proteins that are only found in MS. They might do blood tests, and they may also check your ears for balance to make sure that it's not something else. So having got the diagnosis, what are the treatments? Well, the treatments fall into disease-modifying treatments, or DMTs, stem cell treatment, and we'll go on to talk about all of these, physiotherapy, and alternative remedies. So what's a DMT? So a DMT is a drug that helps, especially in relapsing multiple sclerosis, for the patient to have fewer and milder relapses. So therefore it slows the progression and the disability that they get along the way from the progression. DMTs are now also used in some primary progressive patients. So there is a particular medication called Rebif, R-E-B-I-F, which is a beta interferon 1A. The first DMT for primary progressive that's licensed for it is likely to be available on the NHS this year, so that's great news. There is some evidence that DMTs can actually reverse damage in the relapsing multiple sclerosis and not just slow down progression, so that would be fabulous news, that we can actually undo some of the damage. There's a recent study that used, and this is another one of those words, alemtuzumab, which showed a 28% improvement in a quality of living score, so a disability score, the EDS, which actually indicates whether or not things are getting worse or better. And with that particular DMT, 28% of patients saw things getting better. So that's the good news about DMTs. So I mentioned stem cells, or HSCT, which stands for, are you ready for this? Hematopoietic stem cell transplantation. So we use really strong chemotherapy to kill off the immune system in an affected patient. And then we regrow that immune system using your own stem cells, so you don't have the rejection problem. It's good for when people have active signs of inflammation in their central nervous system, brain and spinal cord, on MRI scan. It's good when people experience their first symptoms. It's good when patients don't have significant disability, because it's not undoing that damage. And usually, if there's active relapse in multiple sclerosis and you've tried to take one DMT and it hasn't worked, then this treatment will be tried. It's less effective for progressive multiple sclerosis without inflammation. And as I said, it can't regenerate damaged nerves. So then we have physiotherapy. So physiotherapy finds exercises to meet your needs. So again, it's a very individual thing. It can strengthen certain areas of the body to support others that are not working so well. It can find new ways for you as a patient to enjoy activities, sports, anything that you were doing but now struggling with. And it can target bowel or bladder issues or pain or muscle spasms and fatigue to just generally help you feel better. It helps mobility, posture, fatigue and balance. So it is an important part of the overall mix of treatment for multiple sclerosis. Then we have alternative therapies. Now, there are lots of these that are used in multiple sclerosis, and I can't vouch for any of them because there just isn't enough evidence on how well they work. But just to give you an idea, they include things like chiropractors, acupuncture, aromatherapy, cannabis, hyperbaric oxygen therapy, massage, Pilates, osteopathy, reflexology, Reiki, Shiatsu, Tai Chi, yoga, and replacing mercury fillings. Amalgam mercury fillings has been shown to help some people. So I will put details of those up obviously in the vlog, and you can actually research some of those for yourself. I'm sorry, I'm really struggling today, as you can hear, and I apologise. Excuse me. So then what about research and new treatments to give us hope for the future? Because at the moment I haven't given you many treatments, have I? So the areas that are being looked at the moment by the Multiple Sclerosis Society are things like vitamin D, myelin repair, stem cells, MSCT, genetics, and neuroprotection. So vitamin D is really interesting. Multiple sclerosis is more common in the Northern Hemisphere, where we are in England. We're further away from the equator. So we have to question the role of sunlight in helping the body to make vitamin D. So can vitamin D treat MS is the natural question that comes from that. There is certainly some evidence that shows that lower levels of vitamin D are associated with higher rates of relapse in multiple sclerosis. In one study, higher levels of vitamin D meant that people were less likely to have a relapse or new lesions after 5 years of treatment. So that's really encouraging. Studies are mixed on relapses, however, and so there's still lots of work that needs to be done and lots of research that needs to be done. There's certainly a role for vitamin D in myelin repair. So vitamin D certainly boosts the number of myelin-making cells in rats' brains by 80%. Children born with very low vitamin D are more likely to get multiple sclerosis later in life. Low vitamin D in childhood may increase the likelihood of developing multiple sclerosis later. So certainly vitamin D is very encouraging, and there's lots of work being done on it now, so watch this space. If there are trials going on, I will put a link for you so that you can see whether or not you could be included on a trial, and that goes for anything I'm talking about today. So in terms of myelin repair, if we could repair the myelin that multiple sclerosis is damaging, we could undo some of the awful effects of it. So we have now identified the molecules that are involved in myelin repair, and we've identified the pathways in the body that help that happen. So under testing at the moment, there are all sorts of medications. So high-dose biotin, which is MD1003, bexaroten, clemastine, anti-lingo-1. These are all drugs that look exciting in terms of myelin repair and are under investigation and research. We know that tamoxifen, which is a drug we use in breast cancer, boosts myelin repair, so that also is being researched. As I've said, we already know that vitamin D might be involved, and this is also being combined with RXR gamma. So there's more research going on that involves vitamin D. And we know that some eczema and athlete's foot drugs also help with myelin repair. So there's lots of exciting stuff around myelin repair, and again, all of these will be detailed in the notes after this. So genetics, what about genetics? Well, Nick sadly says in her video that multiple sclerosis was the only thing her dad gave her because he had multiple sclerosis. We know that there's not one single gene, but we do know that combinations of certain genes, if affected, can make more people susceptible to multiple sclerosis. There are actually 110 different genes linked to multiple sclerosis. Most people with these genes won't get multiple sclerosis because it's a complex interaction with the environment and lifestyle and between those genes. But what we do know is, excuse me, in the UK, your lifetime chance of multiple sclerosis is 1 in 330. If you have a parent with multiple sclerosis, that drops to 1 in 67. If you have a sibling, so a sister or a brother, that drops to 1 in 37. And if you were an identical twin, it's 1 in 5. So certainly genetics do play a role. So as I said, listen to Nick's vlog on her website, PixieWoo, and hear her talk about that. So we will be looking at, excuse me, this must be awful for you, genetics in the future in terms of working out how we can try and avoid multiple sclerosis by looking at genes. So stem cells, we've already mentioned some stem cells with chemotherapy and the immune system. So mesenchymal stem cells are harvested from bone marrow, and that's what's inside every single one of your bones. And then we take a small sample, we multiply it massively into millions of stem cells in the laboratory, and then we infuse it back into the body via the blood or the cerebral spinal fluid which surrounds the brain and spinal cord. Thus far there have been some really encouraging studies. They seem to protect nerves from damage and repair damage at the same time. In 2012 there was a small phase 2 study on secondary progressive MS, and an improvement in vision, so visual clarity, and speed of messages that went from the eye to the brain were seen with these stem cells being used. But as with all of these things, there's lots more work that needs to be done, and I'll put some links to this afterwards. There's some great information on the Multiple Sclerosis Society website. So what about neuroprotection? What about protecting the nerves and the brain from damage in the first place? If we can do that, we might be able to stop those who are at higher risk of getting MS from actually getting it or getting damage from it. So in 2017, the Multiple Sclerosis Society announced that they were co-funding a trial to test if simvastatin, which is actually a cholesterol medication that we use as GPs day in, day out, to see whether that can slow progression in secondary progressive MS. And then there's another trial called MS Smart, looking at 3 other existing drugs that we use all of the time to see if they can be neuroprotective. And we should get results from those this year. So there's some really exciting stuff going on. And it's a devastating disease, so we need to find new treatments, and we need to find them quickly. So I've put lots of links afterwards to the MS Society because they've got links to all of these different research patterns, and it's very hard for me to explain them in detail in a 20-minute vlog. But hopefully I've given you some things to think about and look at, and I can direct you to the MS Society. So in summary, multiple sclerosis is a devastating disease that has different forms, some of them getting worse along the way, some staying fairly static, but there's always a risk one will turn into the other. There are some treatments at the moment which have definitely improved the lives of multiple sclerosis sufferers over the years, but there's still a long way to go. So we need research, and there are some exciting research areas that are currently being looked at and funded across the world, not just with the MS Society, but by scientists across the world. And we should start seeing the results of those soon. We've already seen some encouraging ones this year. So please have a look in the notes afterwards and have a look at the MS Society website. I'll put links to that. If you do think that you've got any numbness, sensation changes, eye changes, visual changes, anything at all that has suddenly, while you've watched this vlog, thought, oh, actually I've got that, go and see your GP, because the sooner MS is caught and treatment started, the better the long-term outcomes. I hope that's helped. Please do have a look at Nick's vlog and have a listen to us on the radio show. And if you've got any questions about this afterwards, post them as always, and I will do my best to answer them. Thank you again for watching. It is always appreciated. Take care.